Healthcare, always a big issue in presidential elections, but according to a new Gallup poll, 2/3 of Americans aren't as convinced this time around. Joining us now on the future of healthcare, CEO of Hologic, Steve MacMillan, a company that specializes in medical technology for women's health. Steve is also the chairman of Illumina. I guess we can talk about the election in a little while, but you're here for a specific reason, which I think is worthwhile to talk about, and that is breast cancer awareness. 1 out of 8 women, totally curable if you get it early enough, but it's hard to get everyone to do what they need to do because of a lot of myths about mammograms, which you specialize in, right? Mammography.
It is very true. And your breast cancer is eminently treatable when you catch it early.
Most common cancer, too.
Yes,
1 out of 8.
most common, yes. Breast cancer, cervical cancer is very common, but also so treatable when you catch them early. And it is the magic of what we keep trying to do in terms of improving the imaging. Also, our new AI detection is helping. And I'll give you 2 great points on how I think AI can completely take us to a different level. And that is, 1, our new AI detection is showing that versus human radiologists, we are catching 1 additional cancer for every 10 that are noticed and read by humans. So as we put this through, if you think about it, it's image detection. So we're catching 1 more cancer for every 10 using our new AI detection. The other part, and Becky, you can appreciate it, and every woman can appreciate, is we're now seeing a 70% reduction in false positives. So when you think about the false, not only are we catching more, but the false positives, and you think about the workflow and the cost and the emotional toll of false positives, right? The woman gets the call back. Now, hey, we want to see you come back in a couple of weeks from now. You're waiting all that time, and you go back in, and so often there's nothing there. But there's been angst, there's cost, there's taking more time off from work, whatever it might be. So these are, everybody's looking for use cases of AI. These are 2 profound use cases that I think can really help, even reduce these numbers better and better for healthcare.
How many women delayed during the pandemic didn't get the mammograms that they needed to get?
We have numbers, they're kind of all over the place, but as much as 40%, even a year after, it appears still delayed. What happens in life, the women are oftentimes prioritizing the rest of their family, and what's really been bad is through the pandemic, everybody lost sense of time. And what seems like having gone 1 year or 2 years is suddenly 3 or 4. So part of what we're seeing now is picking up cancers that are a little bit more advanced that would have been caught earlier because suddenly a woman realizes it's been 4 years since their last mammogram.
You just described me. This is a wake-up call.
Yeah, you're taking care of the kids, you're taking care of everything else. You got, these guys on set, you're, balancing everything, right? So, and it's back to, my own mother, breast cancer twice, both times caught early, and she is 85 and very healthy now.
Right.
So if you catch it early, it's great.
Doesn't really hurt. It can be a little bit uncomfortable.
Speak for yourself.
Yeah, exactly.
A little. We keep
it
it's
fast.
It's uncomfortable.
Yeah, we're working those because our scan times have gotten shorter and shorter, and everything on that.
Dense tissue, you cannot feel density. We have no idea if there's a density. You need to do it that way.
Yeah.
Right.
Yeah.
Some other myths. What are some of the no family history? 85% have no family history.
Exactly.
Or
You're on top of this, Joe. Very impressive.
I almost said F and A. I almost said that, but I didn't. I did just say F and A. Yeah. No, I am. And because it's the greatest thing, we may never. It's so hard to cure cancer because every cancer is different. But if you can detect, like a colonoscopy is a no-brainer. If you don't get a colonoscopy, you're out of your mind because it takes a while.
And by the way, there's less discomfort with that. Maybe the
I don't know about really.
Maybe the
I've had
pre.
discomfort.
I have my next one Friday.
It's the mental discomfort.
Yes, no, it's the prep. But, you know, and it's interesting you talk about dense breast because
Prep.
The night before.
But, yeah.
yes.
You're almost
Paid
taking
to go
off
for
like
a long time.
You almost can lift above the toilet. It's almost like a rocket ship.
There you go. Let's get this back to
All right,
breast
let's get back.
cancer.
So what do you have?
With dense breasts, we're also, our Hologic 3D mammography is the only product approved in the United States for dense breasts. So, which is also, and then again, the AI detection of that, because part of reading the films with dense breasts is there's more fibrous
So AI
tissue.
is already happening for you.
So, yes, and we've been working on it for years. I know it's become the big buzzword, but what's been fun is we've been bringing these innovations that we've been working on for years and years.
Okay, this is all great news. And it's cost effective over the longer haul for somebody along the way. I guess the question is it cost effective for the hospitals to put these machines in? I would imagine insurance gets, you know, the insurance companies are going to make out over this if you are catching stuff faster, if you are doing it. It's just the upfront cost has to be put in by the hospital or somebody to put these things together. And that's not cheap, it's not easy. And sometimes it's with hospitals that have 1% to 2% profit margins.
Yeah, luckily in the grand scheme, mammography equipment is relatively a lower capital outlay than even, frankly, a lot of the IT systems, MRI machines, CT scanners, all those things that are so much more expensive. So the magic for us is there's a fairly good payback for the hospitals, and the usage is incredible. As you put in a mammogram machine, you can be booking them, you know, full out, frankly, and having the woman coming into the hospitals are very good things, and a lot more in the outpatient.
You have to have a more densely populated area where this is happening?
You know, a bit, but even the community hospitals, you know, and, you know, because the best thing we can do really is getting more people to come to them. So we've also been trying to help work with, you know, particularly communities to make sure that they're bringing their women in, particularly post-COVID, where they may have gone the 3 or 4 years and not even realize it. And, you know, you can schedule these, you know, you can schedule a lot of mammograms in a day, so these machines can pay off fairly quickly.
How quickly do you get the result?
It is
in this new AI
varying.
world.
You can get some immediate if the radiologist is right there and reading. You know,
the
often,
radiologist never likes to tell you what's going on.
They're not supposed to.
Yes.
They're not supposed to.
Right.
Let's be honest about it. Can we fix that? Because most times the radiologist who does the work actually knows what's going on,
Yes.
and they're not allowed to tell you.
I always look at them like this, you know.
No, I know. What can we do about this?
We can,
but
to a large
try to
degree, a lot of
interpret
them are being read almost simultaneous or within a day, so you're getting results back
What
much
about
quicker.
the AI reading?
Sometimes. The AI reads can happen very quickly. Now, in today's world, they still need to reflex and have, just from a regulatory standpoint, have a doctor actually oversee it so that you're not totally handed off to the machine.
Well, the other
but
problem
most
is
of these
they don't know how
results
to
can be
counsel
within
you.
a day or two.
Right, they don't know how
at
to
this
counsel
point.
you on, if they say, yeah, we see something, they can't counsel you on what's going to happen and what happens. And
Yes.
it's the worst
I know, but I want the AI to at least tell me. I want to know the initial read, the second read, the third. I look at like waiting for.
I interpret a technician's expression.
I know,
after
it's terrible.
It is. I'm like.
Because
my wife,
like,
tell my wife, he looked a little.
Look at the thing, you know what it says.
What's the radiologist going to tell you? Yeah, there's a tumor. Good luck.
Yes.
No, I go.
Yeah.
He seemed fine, and I kind of like started
You get that
asking,
feel,
and
but
one of them
I
actually
wanna
said, if it's something really bad, they send you somewhere immediately. They don't just send you home like with a long.
Yeah, the other magic
Yeah,
that AI is bringing is, if you think about, there is still a lot of, I hate to say human error, but there is human interpretation of all of these things. And when you think about particularly our 3D, which generates more images, it's generating about 60 images per mammogram. That's a lot of data to absorb. In the AI world, what's great is it can scan it very quickly and then pick it out and send it to the radiologist and say, hey, go look at slide 36. And double check that instead of looking at all 60. And when you think about just the fatigue, right? I always think about it's like automotive manufacturers. You don't want to get the car that's made Friday afternoon. Right. Exactly. There's a little bit of that. And also the variation that here in New York, you're at the top institutions. As you go out into rural America, as you go to community hospitals or everything else, you might not have a radiologist that is as advanced at reading these things. So that, to me, and particularly as you go around the world, the ability to really automate the reading of these images becomes profoundly better at being able to get both faster results and better results.
What should this stuff actually cost?
What should it actually cost? Well, a mammogram is, call it $100 to $200, is really what they end up being. When you think about the value.
I'm not sure that's true in New York City.
So,
okay.
all right, but that's generally
but this is what I'm saying. Look, I went to get an MRI, and I remember the guy wanted to charge, you know, I don't know, it was $2,000 or something. I was like, really? Wow.
Yeah.
That's something. So but they're all trying to advertise these machines.
Yes. So, but they will totally make up for the amortization of those machines well within that range. So, you know, I think about it relative to the cost of prescription drugs. You know, these are cheap. Right? Think about the cost of a prescription drug versus an annual mammogram at a couple $100. I'll take the mammogram
we didn't get to talk Hologic
all day long.
Or I'm sorry, Illumina, and there's a lot of AI there too, and, right? But maybe next time.
Yes, there is. Sure.
You can like save all of us with all the hats you're wearing. Right?
A lot of opportunity.
Yeah.
So
Come back, Steve.
great. Great to see you.
We don't
again.
say Stryker anymore. Stryker.
No, that's been a long time.
Stryker.
12 years, believe it or not.
Yeah, 12
since I was
years
there.
since you were at
Since I was there.
Oh my
Used to
God.
bring you the bone saws. I know you always loved those.
Yeah, those bone saws. He's a wrestler.
That was so.
I think he's a wrestler in Spider-Man.
Oh, is he?
Yeah, he was a wrestler
All
in
right.
Spider-Man.
There you're going beyond my
Bone
scope.
saw.
Steve, thanks a lot.
Becky, great to see you. Joe,
Thanks.
Andrew.